Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Elevated blood pressure. Introduction. High blood pressure is known as hypertension. Blood pressure that is slightly high is called elevated blood pressure. It is likely that elevated blood pressure will turn into hypertension if you do not make lifestyle changes. Elevated blood pressure and hypertension increase your risk of heart attack, stroke, and heart failure, but weight loss, exercise, and other healthy lifestyle changes can often control slightly high blood pressure and prevent complications. This program explains elevated blood pressure. It covers symptoms and causes of the condition, as well as treatment options. Blood pressure. The blood carries oxygen and nutrients to all parts of the body. The heart pumps blood out of its chambers through blood vessels. The blood vessels that carry fresh blood from the heart to the body are called arteries. Blood pressure is the force of blood on the walls of the arteries. Blood pressure changes all the time. It may vary when it is measured at different times, even minutes apart. Exercise or emotional stress can increase blood pressure. The body can tolerate a temporary rise in blood pressure, but health problems can happen if your blood pressure is always high. High blood pressure is known as hypertension. Blood pressure that is slightly high is called elevated blood pressure. Symptoms and causes. Elevated blood pressure doesn't cause symptoms. Even high blood pressure that is severe may not cause symptoms that you notice. Most people find out that their blood pressure is higher than normal during a routine exam or visit with their healthcare provider. You should have your blood pressure checked at least once every 2 years. You may need readings more often if you have risk factors for cardiovascular disease or elevated blood pressure. You can also check your blood pressure at home with a blood pressure monitoring device. Blood pressure readings have a top number and a bottom number. A healthy blood pressure reading usually has a top number below 120 and a bottom number below 80. If your reading is consistently higher than these numbers, you have high blood pressure. High blood pressure usually develops gradually over many years. Elevated blood pressure can be caused by any factor that increases the pressure of blood against the artery walls. One factor that can increase blood pressure is atherosclerosis. Atherosclerosis is the buildup of fatty deposits in your arteries. Certain medical conditions can cause high blood pressure. These include adrenal disease, diabetic kidney problems. Other medical conditions that can cause high blood pressure include sleep apnea, thyroid disease. Certain medications may cause blood pressure to temporarily rise. These include birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs. People with certain risk factors are more likely than others to develop elevated blood pressure. A risk factor is something that may increase your chance of developing a condition. Being overweight or obese is a risk factor for hypertension. The greater your body mass, the more blood you need to supply oxygen and nutrients to your tissues. This increases the force on your artery walls. Elevated blood pressure is more common in men than in women. A family history of high blood pressure can increase your risk of developing the condition. Eating a diet that is high in sodium or low in potassium can increase your blood pressure. These nutrients affect the way your body regulates your blood pressure. The following can also increase your blood pressure: daily alcohol use, smoking cigarettes, using other tobacco products, being exposed to secondhand smoke. Having one or more risk factors does not mean that a person will develop elevated blood pressure. It is also possible to develop the condition without any risk factors. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Complications. Elevated blood pressure is likely to worsen and develop into hypertension without treatment. Hypertension is known as the silent killer. It usually develops gradually over many years. High blood pressure harms your blood vessels. It raises your risk of the following conditions: heart attack or heart failure, kidney failure, stroke. Hypertension also raises your risk of dementia. Diagnosis. Blood pressure is usually measured as part of a routine physical exam. Your healthcare provider will ask you questions about your personal and family health history. Your healthcare provider will measure your blood pressure with an inflatable-arm cuff. Wear a short-sleeved shirt to your checkup so that the cuff can fit around your arm. Your healthcare provider will put the cuff around your arm and pump air into the cuff. The cuff is connected to a gauge that measures pressure. The cuff will squeeze your arm and take a blood pressure reading. A diagnosis of elevated blood pressure is based on the average of 2 or more blood pressure readings taken at different times. Caffeine can affect your blood pressure. Avoid beverages or foods with caffeine before your blood pressure is measured. You should also go to the bathroom before having your blood pressure measured. Treatment. Diet, exercise, and other lifestyle changes can help many people lower their blood pressure. Your healthcare provider may recommend medications if lifestyle changes do not lower your blood pressure enough. Medications may also be prescribed if you have elevated blood pressure as well as another medical condition such as diabetes. Eating healthy foods can help lower blood pressure. Choose vegetables, fruits, whole grains, and low-fat dairy options. Eat less saturated fat and trans fat. Do not add salt to your food. Read labels to find out how much sodium is in food. Limit the processed and canned foods that you eat. These include soups, frozen meals, and packaged snacks. Maintain a healthy weight. Lose weight if you are overweight. Regular physical activity can help you lower your blood pressure. It can also help you control your weight. Try to be active for at least 30 minutes every day. Do not smoke or use other tobacco products. If you do smoke, talk to your healthcare provider about treatments that can help you quit. Drink alcohol only in moderation if you choose to drink. For healthy adults, drinking in moderation means adult women can have 1 drink per day. Men over age 65 can have 1 drink per day. Men younger than age 65 can have 2 drinks per day. Reducing stress can also help control and prevent high blood pressure. Getting enough sleep can also help. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. High blood pressure is known as hypertension. Blood pressure that is slightly high is called elevated blood pressure. Elevated blood pressure is likely to turn into hypertension without lifestyle changes. This usually happens gradually over time. High blood pressure harms your blood vessels. It raises your risk of the following conditions: heart attack or heart failure, kidney failure, stroke. These conditions can lead to death. Certain medical conditions, such as sleep apnea, can cause high blood pressure. Certain medications can also temporarily increase blood pressure. People with certain risk factors are more likely than others to develop elevated blood pressure. Risk factors include being overweight, eating a diet that is high in sodium or low in potassium, family history of high blood pressure, smoking. Elevated blood pressure doesn't cause symptoms. Even high blood pressure that is severe may not cause symptoms. Most people find out that their blood pressure is higher than normal during a routine exam or visit with their healthcare provider. Blood pressure is usually measured as part of a routine physical exam. You can ask your healthcare provider to measure your blood pressure, or you can learn to measure it at home. To control and prevent high blood pressure, eat a healthy diet, exercise, limit alcohol, quit smoking if you smoke, reduce stress, and get enough sleep. If healthy lifestyle choices do not lower your blood pressure enough, your healthcare provider may prescribe medications. Thank you for using Explain.